Hi, I'm Carla, an emergency nurse from South Australia. On behalf of the College of Emergency Nurses in South Australia, I'd like to welcome you to our conference and I'd like to share our vision with you. Enjoy.
Essentially, emergency nursing is very demanding, very tiring, physically demanding.
Oh God, the challenges, unbelievable challenges.
That I've made it through the shift, that I've helped someone with their life and supported not only them but their families, and that I've probably learnt something new that day, because I learn something new every shift.
Flying lessons is not just about education, but the lessons we start learning from the time we first decide to become emergency nurses. It is about how we proceed through the roles to gain confidence and then excellence as an emergency nurse. At the CENA 9th International Conference, you'll hear stories of how emergency nurses front up every day despite personal and professional fatigue. How do we improve our nursing practice and patient care despite rapid changes, increasing patient presentations and often limited resources?
Working with different people every day, you get to work with a lot of great doctors and nurses, and it's a lot of fun.
From backgrounds for emergency and intensive care, it's important that people get the right collaborative going on, networking with other states, other countries, other hospitals within their own states to work out the best way to do things, change practice, learn new initiatives, all that sort of stuff. That's what's very important. Plus, it's a good social atmosphere.
Emergency nurses in Australia and across the world contribute significantly to care in the air. Whether it be the Royal Flying Doctors or civilian or military retrievals, this part of the conference may be of interest to you. Flying by the seat of your pants is a section of the conference that focuses on emergency nursing roles in retrieval and flight nursing. Whether you are one, are interested in becoming one, or just want to hear what it is all about, this section of the conference may be for you.
I am most proud of getting my degree when I was 45.
I mean, when we share experiences with each other, we're only going to better our care that we give our patients.
It's going to be exciting, it's going to be about emergency, it's about what we do, it's catching up with people who do the same job as you do but in different environments, and it'll be a good way to see where you are.
If you have not had the opportunity to present before, or the thought of presenting at a conference overwhelms you, then why not consider presenting at this conference? There will be a novice presenter section where you can do a shorter presentation with other nurses who are giving it a go for the first time as well.
And it's a great chance for people to come and share their knowledge and network.
Never. Adelaide is not boring.
Is it? Don't be put off by the bad press. It's not boring. There's plenty on. Come over.
Just come and have some fun with us.
And here it is. The Adelaide Convention Centre. The facility we're in. A true Congress Centre. A 5-star hotel without the rooms. And you wouldn't believe the international connections that link the Adelaide Convention Centre to an entire world of excellence, like the big hotel brands, and when a superior airline lands. And what an environment the Adelaide Convention Centre is in. You wouldn't believe how inspirational it is, how tasteful, how prestigious, and how artistic. The Adelaide Convention Centre, the true Congress Centre that's truly world-class. Just as well you've seen it. Otherwise, you just wouldn't believe it.
Wouldn't you like to attend a conference and be updated with the latest knowledge and education relating to best practice emergency care for your patients? Conferences can sometimes be quite research driven and not about hands-on clinical practice at the bedside or in the resuscitation room. Our conference has a very clinical focus. The aim is to provide clinicians with a one-stop shop conference that will incorporate updates on evidence-based practice in emergency care.
I think once an emergency nurse, always an emergency nurse.
For the benefit of Australians, patients.
It's just a great way to grow.
then we would love you to join us at the 9th International Emergency Nursing Conference to be held in Adelaide, South Australia in September next year.
At the end of the day, it's job satisfaction, and you feel good when you can help somebody.
Now you know our vision, you've seen our venue and you've heard our voices. Now we would like you to share it with your colleagues, and we look forward to seeing you in 2011.